the legacy of the Medicaid expansion program and the story of how we got there. That story is a story worth telling.
Right before its passage, Arkansas had one of the highest rates of uninsured adults in the country.
I think if you looked at it from the start, you're like, no, this just can't happen.
You have to have 75% of your House and Senate to get an appropriation. That is not easy when it's a contentious issue. We knew from the beginning we were going to have to change people's minds.
You have a period in time where the governor is the only Democrat statesperson within the entire state dealing with the Republican legislature.
Obamacare, the ACA were not popular, particularly with conservatives, nor was the idea of expanding Medicaid, which was seen as to some degree a public welfare program.
I can't tell you the number of times, I was just told, we're not doing anything that y'all want until we come up with an answer on healthcare. If you don't like Obama's plan, what's your plan, Burris? I can hear the words coming out of mouths like it was yesterday.
So the idea of the private option came about really from the idea of, okay, if people don't want to expand Medicaid, is there some other way to go about this what wouldn't necessarily be considered Medicaid?
There were no states that were politically situated like Arkansas who had done this. So there was not a blueprint.
It's truly a political moment, but also a historic moment, because we had a lot on the line in our state if we did not figure out the private option.
At the time, healthcare costs were the number one reason for personal bankruptcy. That made it hard on local providers who often couldn't get paid. Local hospitals were struggling.
We were also having a conversation at the Department of Human Services about the Medicaid budget. And could we sustain the trajectory we were on? Could our budget allow us to continue to serve? There was an opportunity here if we could just figure out how to make this work.
We had lots of strikes against us in getting this done. We were a Southern conservative state with a new legislature. For a lot of these members, they really felt like voting for this bill was putting themselves at risk, in terms of getting reelected. Even if they saw it as something worthwhile, for them it was a trade-off between, okay, I can do this one worthwhile thing, or I can stay in office and do 10 worthwhile things. So, there were some really tough struggles by a lot of individual members as to whether to vote for this.
So in came the idea of expanding Medicaid coverage, but rather than enrolling those new folks into the Medicaid program, the traditional Medicaid program, we would actually use Medicaid dollars to pay their premium to enroll in private health insurance. And that brought a whole new group of supporters to the table because we now had private insurers who saw the opportunity as well to be a part of this new innovative approach to healthcare in the state.
Figuring out how to both make our marketplace more successful and drive down the cost of those plans by adding 250,000 people to that pool of insured individuals was, I think, a really genius idea politically.
It wasn't a policy that happened just because the governor realized that there was an allowance from the federal government that would help the state of Arkansas. There were so many individuals in the community representing so many different areas, right? All convening and talking about the importance of health.
Ultimately, it became a great example of bipartisanship.
For example, there's a real concern about personal responsibility and not having an ongoing federal program. So one of the compromises in the bill was to say, okay, this is going to have to get re-upped every year. I'd have loved to have it for perpetuity, but that was kind of an easy give, if that's what it takes.
You have to look at both sides of an issue, and this one was not black and white. It was good for people, and it was good for our economy. Approaching it from that perspective for me was the most important. Like, how do we help the working poor, but also help our state and our healthcare infrastructure too?
As a result of Medicaid expansion passing, what we saw is our rates just skyrocket in terms of the number of individuals that now had access to insurance.
Tons of people in Arkansas suddenly had access to preventative screenings, routine care, substance use and mental health treatment that didn't have it before. We reduced preventable deaths. There's been this tangible benefit across our state.
All the studies that have been done in Arkansas and nationally show the impact on the public has been terrific.
Most of us want the same thing, and we just have different perspectives about how we get there. And so I think if advocates can find that sweet spot, there's a whole lot that we can accomplish for children and their families, regardless of the political environment that we're navigating.